Doctor, you were mentioning esophageal stricture? Yes, I was. What is that? It is a dilation of the esophagus with Bougue's, which is a flexible instrument resembling sounds used to diagnose and treat strictures of tubular passages. And doctor, what is an esophageal diverticulectomy? An esophageal diverticulectomy is an excision of the diverticulum and closure of the resulting defect. Doctor, what about an esophagojejunostomy? An esophagojejunostomy is the formation of a communication between the esophagus and the jejunum. And doctor, esophagoplasty? Esophagoplasty is the reconstruction or plastic repair of an esophageal defect. Doctor, what is esophagoplasty with reversed gastric tube? That is a physiological method of esophageal replacement using the patient's own stomach to avoid immune reactions caused by rejection of transplants. Doctor, what about esophagography? Esophagography is the suture of an injured or ruptured esophagus. And fundic patch operation? A fundic patch operation is a surgical procedure for repair of a ruptured esophagus or acid peptic stricture and in the treatment of advanced achalasia. Doctor, what is fundoplication? Fundoplication is the operative procedure to relieve gastroesophageal reflux of large amounts of acid peptic juice and to restore gastroesophageal competence. And Heller's operation? Heller's operation is a surgical procedure for achalasia of the aorta. Doctor, you mentioned in your hospital record the radical resection for esophageal cancer. That is correct. What is that? That is an excision of the tumor-bearing portion of the esophagus and the regional lymph nodes, followed by restoration of the continuity by anastomosis or interposition of the loop of colon or jejunum. And resection, doctor, for esophageal stricture? That is the removal of extensive narrow segment followed by colonic bypass. The right colon with terminal ileum and ileocecal valve is tunneled into the neck and anastomosed with the proximal esophagus. The operation is indicative of chronic stricture, which is unresponsive to bourgeonnage. Doctor, what is dysphagia? Dysphagia is difficulty in swallowing. And regurgitation? Regurgitation is a backflow of gastric contents into the mouth. Doctor, what about the fundus? The fundus means the base. And the omentum? The omentum is the membrane enclosing the bowel. What is the pylorus? That is the gatekeeper, essentially. And the cardiac orifice? The cardiac orifice is the opening at the junction of the esophagus with the stomach. What about curvatures of the stomach? Yes, they can be lesser or greater. What about the lesser? The lesser is the right and superior margin of the stomach. And the greater? The greater is the left and inferior margin of the stomach. What is the fundus of the stomach? That is the enlarged portion to the left located above the level of the cardiac orifice. What is the omenta? The omentum is the peritoneal sheet connecting the stomach with other viscera as the liver, spleen, and transverse colon. And the pyloric sphincter, doctor? The pyloric sphincter is the circular muscle around the pylorus. What is the pylorus? The pylorus is the opening between the stomach and the duodenum. And the rugae are irregular folds of the mucous membrane of the stomach in which gastric glands are embedded. Doctor, what is a gastric neoplasm? Well, if it is benign, it is a new growth of the stomach that rarely interferes with gastric peristalsis. Unstop that movie.
Oh, yeah.